We will discuss about one of the important topic, that is tuberculosis. So tuberculosis, what is tuberculosis? What is the pathophysiology of tuberculosis, and what are the drugs which are used in the treatment of tuberculosis? In simpler way, we can say we'll discuss about pharmacotherapy of tuberculosis. So what is tuberculosis? Tuberculosis is one of the respiratory disorder which is caused by the bacteria called as Mycobacterium tuberculosis. So this is one of the bacterial disease, and it is transmitted through Mycobacterium species. And if the tuberculosis or the bacteria, if it is invading the lungs, then it is called as pulmonary tuberculosis. Whereas if the bacteria it is invading other parts excluding the lungs, then it is called as extrapulmonary tuberculosis. What are the symptoms, or as we can say, what are the characteristic features observed in a person when he is suffering with tuberculosis? So one thing we can observe is that the person will be suffering from cough. If the cough is resisting, or as we can say, if the cough is resisting for more than 3 weeks, then the person is definitely suffering with, or else we can say he is initially suffering with tuberculosis. So the cough is there for more than 3 weeks of period, and it is not even treated with antibiotics. If you give antibiotics to that particular person also is not recovering from cough, then definitely suffering with tuberculosis. And there will be weight loss in the person, and there will be sweating, heavy sweating in that person, and even there will be the body temperature will be raised more than the normal one. If the in fever, normally generalized fever, the temperature can be raised up to 102, 103, or maximum 104. But if this temperature after raising, if it persists for longer period of time, then definitely suffering from tuberculosis along with cough. And there will be the production of purulent, in the sense there will be formation of pus. There will be formation of pus in the respiratory cavity, as well as while he is when we observe a sputum, the person's sputum will be bloody in nature. Because of the excessive cough, the capillaries which are there in the respiratory system, they will be damaged, and blood can be observed in the sputum. Let us see the etiology. That is, what is the bacteria, pathogenesis of bacteria, how the bacteria is causing tuberculosis. So mainly, the main species which is causing tuberculosis is Mycobacterium tuberculosis, and there are other species also which are causing tuberculosis. That is Mycobacterium africanum, Mycobacterium bovis, Mycobacterium microti, as well as Mycobacterium candidate. These are also few of the species of Mycobacterium which are causing tuberculosis, and these bacteria are of rod shape in structure. We can see the diagram here. The initial picture shows the staining of the bacteria. In the blue coloration background, we can see a pink color rod shaped substances. These are nothing but bacteria which are stained in Ziehl-Neelsen stain. Let us see the characteristic features. How does this Mycobacterium tuberculosis look, or else what are its characteristic features? I think it will have a thick lipid cell wall. As it is a bacterial wall, it is having a thick lipid cell wall. The size of the cell wall is ranging from almost 0.2 to 0.5 microns in diameter, as well as 2 to 4 microns in length, which is not visible to naked eye, can be observed only under the microscope. And it is a rod shaped. As I told you, it is a rod shaped bacilli bacteria, and it is acid fast resistance. What does this mean? It is decolorizing, or as we can say that it is stained only under acid based stain. We can't stain it in the normal stain. That is the reason this bacteria are stained with the Ziehl-Neelsen stain, which is an acid fast stain, and these multiplies very slowly, whereas the multiplication capacity or the cell division capacity of this bacteria is very slow, which is almost about 18 to 24 hours. If we see other type of bacteria like E. coli, Escherichia coli, they divide very rapidly. The reproduction or cell division capacity of these bacteria is very high when compared to Mycobacterium. It contains a thick lipid cell wall, and also it will be in the dormant stage, or else it will be in the sleeping stage for longer period of time. That is the reason it will be difficult to analyze, or else we can say to observe the symptoms in a person in the initial stages. So as it will be dormant for longer period of time, or else it will be in the resting position in the dormant period of time, in the meantime it divides, and it spreads all over the body, where it will be almost, the person will be reaching to final stage of tuberculosis. So we have to analyze in the initial stage only. If a person is having severe cough for more than a week, or else we can say for more than a week or more than 3 weeks, and is not treated by antibiotics, definitely the person has to be examined immediately. And it is aerobic in nature. It is aerobic because for its cell division and for its respiration, it utilizes oxygen for its division, and it is non-motile substance. It can't be movable. That is the reason it needs a carrier for its movement, or it needs a carrier to transmit from one person to the other person. How does the transmission takes place, or else how a person is infected with tuberculosis? One thing, if we see, or else if a person is suffering from tuberculosis, and if a healthy person come in contact with the air or with the droplets of air or sneeze, if a healthy person come in contact with the infected person, then definitely the bacteria will enter into the healthy person, and thereby the tuberculosis is spread. So here we can see the droplets directly entering into the healthy person. He will be definitely suffering with tuberculosis, and definitely it is less, or else this is the main mode of transmission. And there is another mode of transmission, like in the laboratory conditions, or else we perform laboratory experiments. If we see microbiology, we perform laboratory experiments where the bacterium culture is used for experimentation. So while handling, or else the students who are performing, or the persons who are performing the experiment, should handle with care. Otherwise, if there are any laboratory accidents, or else by accidentally, if a person breathe in that E. coli or breathe in that bacteria tuberculi, then definitely the bacteria will enter into the person, healthy person, and thereby he may suffer from tuberculosis. If we see here, if an infected person is there, if an infected person, if he coughs, more than almost 3,000 droplets of nuclei are present. If infected person coughs, then almost 3,000 nuclei of bacteria is spreading into the air. Then imagine how, if a healthy person stands in front of that infected person, how the infection is getting transmitted very easily. And even in that sneezing droplets, even thousands of, we can say millions of bacteria are available, because these nuclei, they may replicate inside the body, and if a person sneezes almost 3,000 droplets, then some millions of bacteria are present in these 3,000 droplets, and thereby the person is more susceptible to tuberculosis. Let's see what are the factors which are influencing for transmission. So what makes the bacteria to get transmitted, or else we can say how the transmission of tuberculosis is taking place. So here, the number of organisms which are present in the air. For example, if you take a particular area of air, in that air, how many number of these Mycobacterium tuberculosis bacteria are present, that determines the mode of transmission. If X number of bacteria are there, for example, if it is affecting 2-3 persons, then imagine 100x of bacteria present, then how many persons will be imagined? The more number of organisms, the more the infection. And the concentration of organisms. So here the concentration, in the sense the extent, or else we can say the capacity of the organism to spread. See here, in the air there may be living as well as non-living organisms also. All the bacteria which are released into the air cannot be alive. So here the concentration of bacteria which are in live state and they are spreading infection, that also determines the mode of that also determines the capacity of the transmission. Near the volume of the space, or else ventilation. So if a more ventilated area is present, then the bacteria may spread, and thereby the concentration of the bacteria may decrease. But if less area is present, then concentration of the bacteria increases, whereby the person is more prone to transmission. And the other one is length of time, in the sense for how much time the person is exposed to that infected air. If a person is exposed for longer period of time, then he is more infectious for this tuberculosis bacteria, whereas if he is exposed to less period of time, then he is less prone to infection. And the other one is the immunity status. So the person should be immunoprotective. If the person's immune system is not that strong enough to even resist this bacteria, then that person will be more prone to infection. If he's having weak immune system, then the infection will be spread very easily in that person. If a person is having strong immune system, the person may not be infected or less infected with the bacteria. What are the risk factors which are involved in tuberculosis? So one thing is that if a person is suffering from any immune related disorders, immune system related disorders, for example HIV. So if a person is having HIV, then automatically he'll have tuberculosis. HIV is such a disorder, like it is a set of various disorders. So tuberculosis is one of the disease or disorder which is involved in the HIV patient. So in the HIV patient, as the immune system is very weak, he is prone to many bacterial diseases, one of which is tuberculosis. And the other one is if a person is undergoing immunosuppressant therapy, or else if a person's immune system is hyperactive, then we give immunosuppression. In order to suppress the activity of the immune system, we give immunosuppression therapy for that patient. So if a person is undergoing immunosuppression therapy for longer period of time, then that person is also more, we can say that group of people are more risk for this, more risk to prone this kind of infection. And the other one is healthcare workers. So persons who are working, or as we can say who are working under this, we can say that who are working in hospitals, who are working in nursing conditions, as well as who are working in the laboratory conditions. So these kind of people are more prone to infection, because they see many kind of people who are infected with one or the other bacterial disease. So these kind of persons are more prone to infection. And if a person is having the habit of taking alcohol, even the smokers, drinkers, all these persons are prone to bacterial infection, as well as recent tuberculosis infection. So this is like, we can say it is easily spreadable. We can say it spreads easily in the infants, or else we can say who are having weak immune system in their body, they are also more susceptible to this tuberculosis, as well as HIV infected persons and in the kids. So small children are more prone to this bacterial infection. Why? Because in children or infants, the immune system will be in the developing state, which is not fully developed. So in that condition, if the baby or infant is invaded with that bacteria, then definitely the child or the infant will be suffered from this tuberculosis bacterial infection. Apart from that, if a person is or else we can say in silicosis conditions. What does this silicosis mean? If a person is exposed to air, or else we can say if a person is exposed to air which is containing silica. So silica is one of the element, if when enter into the body, in the body it reacts with hemoglobin as well as oxygen, and it forms very toxic compounds. So if a person is exposed to air containing silica for longer period of time, in that condition also is prone to tuberculosis. And if a person is taking the corticosteroid therapy for longer period of time, so corticosteroids have fewer side effects. One of the side effects of corticosteroids is immunosuppressant. So for that reason, if a person is taking corticosteroids for longer period of time, then he is more prone to tuberculosis, as well as the immunosuppressive therapy. And if a person is having low body weight, if the person's weight is below his BMI, then definitely because of the weak immune system, or else because of the weak body he has, then definitely the person will be susceptible to this bacterial infection. And in diabetes mellitus condition also. So in diabetes mellitus condition, diabetes is also one of the complicated disorder which is involved with various other cardiovascular diseases. So in that condition also, the person will be not in all diabetic conditions, but in few persons who are having weak immune system, they are more susceptible to tuberculosis. And the health and hygiene, we have to maintain a clean environment condition. So if our environment is not hygienic, then in that cases also the bacterial infection is mostly observed. Let us see the sign and symptoms of tuberculosis. So what are the main sign and symptoms? So first thing is that we can observe dry cough, that will be a marked symptom if a person is suffering with dry cough for a longer period of time, and if it is untreated, then definitely that is one of the symptoms which we observe, and the person will have bloody sputum, and there will be difficulty in breathing also. Here all we can see the pictorial representation. See the one which are observed in the grey lines, like we can see the symptoms like chest pain, structural abnormalities which are observed in the X-ray, and cough with increasing mucus as well as increasing or else cough or else sputum which is containing blood. So these are the markable symptoms of the tuberculosis. That is initial. These are the primary symptoms of tuberculosis. So there are other symptoms also, like we can see the productive cough. There will be night sweats as well as dry cough, weight loss, fever, weakness, and many gastrointestinal symptoms. So these are few of the symptoms, but markedly, if anything, any symptom which is related to respiratory system, then definitely the person is we can say that the person, by seeing the person, we can say that he is suffering from tuberculosis. Here we can see the epidemiology. So how many persons are susceptible to, if we take the all over the world. So here we can see the statistics. The area, especially we can see the Africa continent is more prone to tuberculosis, because there we can see the hosts which carry this bacterial infection. So these are many hosts are there which are carrying this bacterial Mycobacterium tuberculosis. So here these hosts which carry the infectious bacteria, they are present mostly in the Africa region, and after that Asia is one of the continent which is suffering with tuberculosis. So most of the persons are prone, most of the persons in Africa as well as Asia are prone to this tuberculosis bacteria. So if we see the pathogenesis, initially from the infected person to the healthy person, the bacteria enters, and thereby first it invades the macrophages. So these are one of the important, we can say important immune cells in the body. So if any bacteria or any virus or any microorganism which is entering into the body, these macrophages as well as lymphocytes, they will be the first line of defense. So they will be in the initial phase of the defense, and if they cannot invade, if these bacteria invade these macrophages or lymphocytes, then they will damage the nuclei which is present in these cells, and thereby these bacteria, they divide in the lymphocytes and macrophages itself. So when this infected cell in the body, it is spreading, it is dividing, and it is spreading all over the body, then the infection will be spread throughout the body. So the main mode of, or as we can say, the main area of this cell division is respiratory system. So the cells or the bacteria will divide mainly in the respiratory system, and it spreads to other parts of the body also. And this tuberculosis is a communicable disease, but it cannot be even spread by a hand touch by a single person. So the mode of transmission is only through the air droplets. So if we see, it cannot be if we share the dishes, or as we can say, if we use the dishes or the utensils which are used by that infected person, then we won't get tuberculosis. We can say the bacteria cannot be spread with this kind of mode. And if we use any clothing of the infected person, then also the tuberculosis is not spread. And if we handle food, or as we can say, if we serve food to that person, then also the tuberculosis is not spread. And at the same time, if we share the things which are used by the infected person, then also it's not spread. So the only mode of transmission is through air droplets or sneezing droplets. Let us see the diagnosis of tuberculosis. How can we diagnose? So initially the normal test will be conducted, like hemoglobin test, DLC count, that is differential leukocyte count, then platelet count, and ESR. So these are the common diagnostic tests which are performed, and in the severe conditions, then X-ray of the person should be performed. So in the X-ray we can see the abnormalities in the ribs, or as we can say in the posterior as well as anterior segments of the lungs. We can observe the abnormality condition. So when we compare the normal X-ray with the infected person, we can observe the changes here, and there will be if we compare the infected, or as we can say non-HIV infected tuberculosis person to HIV infected tuberculosis person, then also the X-ray varies. So in the HIV suffering person, if in a person who is suffering with HIV and also tuberculosis, the X-ray differs from the person who is affected with tuberculosis but not HIV. So, what are the diagnostic tests which are performed? So, there are various tests which are performed. One is tuberculin test or Montauk's test, and the other one is dot test. So, these are the tests which are performed in order to make sure for the confirmation of this tuberculosis. So, here in the initial, this test is performed in 3 stages. So in the initial stage, we just give the intradermal injection of almost 5 international units. So in this Montauk skin test, so first the intradermal injection is given to the person at the dose of 5 international units. PPD is nothing but pharmaceutical preparated dose. So it is given in the pharmaceutical preparation dose, and the person is the extensor aspect of forearm tuberculin. So here we are giving tuberculin to that person at the dose of 5 international units, and after that, after the 48 to 72 hours, then we can observe the redness in the area where the infection, the injection is given. So initially the person is given tuberculin through IV route, and after 48 to 72 hours we can see some sort of reactions at the place where the injection is given. So why? Because is that the tuberculin which is injected into the person, it shows some sort of reaction against the bacteria. So this rash we can confirm the person whether he is suffering with tuberculosis or not. So here Montauk's injection site, if a person is subjected to that, then in this way we can diagnose how the person, the more amount of rash, or else we can say how much the rash can be observed, the person is more prone to that disease. So if a person is having rashes in the area for a longer period of time, or else if a person is having rashes in more surface area, then the person is we can divide this stage, or else we can say the person is having final stage of tuberculosis. So the amount of rash is based on which the diagnosis, or else we can say the amount of rash can decide the person how extent he is suffering with tuberculosis. The other test is sputum. So we have to collect the sputum from the saliva, or else we can even collect the sputum from any meal also. So either we can collect it from saliva or meal, or even we can use the toothbrush also for collecting the sputum. So we have to observe take the sputum, and we have to stain it under the Ziehl-Neelsen. We have to stain it with Ziehl-Neelsen, and there in that sputum we can observe bacteria. So here we can see the pictorial representation. So normally after the sputum is collected, we have to put that sample on the microscope, and we have to put Ziehl-Neelsen stain on that. But as this is as these are acid fast decolorization bacteria, because of the Ziehl-Neelsen stain, when we put it on that, we can see the coloration of the bacteria. Here in the diagram we can see the red coloration, or else the pinkish coloration of the bacteria can be observed because of that stain. The other one is culture. So what does this mean? This technique is used to confirm the tuberculosis to maximum extent. So first thing, we have to collect the specimen of the person, either it may be saliva or secretions of respiratory system, and we have to culture that particular sample on the agar media. So if we culture that particular sample on the agar media, then in the agar media this bacteria have the capacity to divide or spread colonies. So in that with this test we can see how much amount of tuberculosis, or else we can say how much extent the person is suffering from tuberculosis disease, and this result can be observed 4 to 14 days after we put the culture. So first we have to inoculate the culture medium with the sample of infected person, and after 4 to 14 days we can observe the result where the bacteria is spreading in that particular culture media. So here we can see this is Lowenstein-Janssen media. This is also one of the media, agar media and Lowenstein-Janssen media. So these two are the media, and this Lowenstein-Janssen Media is the mostly used media for the diagnosis of this tuberculosis, especially through culture method. So we can see in this media the bacteria is spreading in colonies. So what are the lumps which are formed? Those are nothing but bacterial lumps, so bacterial colonies. So here in this green media, we are putting the infected person sample, we are inoculating the infected person sample, and thereby after 4 to 14 days we can observe the development of bacteria in that particular media in the form of colonies. So why these tuberculosis cannot be treated with normal antibiotics? So normal antibiotics, they are just used to, we can say they are just used to protect the normal bacterial infection. But this kind of Mycobacterium tuberculi, what does it do? It divides, it will, as it is in the dormant stage for longer period of time, these antibiotics cannot recognize the bacteria and thereby they cannot act on the bacteria. So that is the reason tuberculosis is not treated with normal antibiotics. And it is also even as these this bacteria, Mycobacterium species, they are having a thick lipid cell wall, these antibiotics cannot pass through that particular cell wall, and thereby if they cannot pass through the bacterial cell wall also, they cannot invade the bacteria, and thereby they do not show any effect on the bacteria. So there are two reasons why this tuberculosis is not treated with antibiotics. One is because of the dormant stage or a longer dormant stage of the bacteria, and the other one is because of the thick lipid cell wall where the bacteria is having. And so this Mycobacterium, it is having a very characteristic feature that it will develop resistance for one drug. So if we give only one drug or else treatment with one drug for longer period of time, this bacteria will resist for that drug, and if we give that drug for further use also, then this bacteria cannot be killed. So in that case, the tuberculosis cannot be treated. So for this, the multi-drug treatment should be given. So we have to use more than 1 or 2 drugs in order to treat tuberculosis. So how does the treatment can be given, or what are the treatment can be given? First thing is that multiple drugs are to be given. So multiple drug treatment should be given in order to we can say in order to prevent the bacteria to resist against the drugs, as well as we need to observe DOTS. DOTS is nothing but directly observed treatment short course. So here in this DOTS, what we have to, the healthcare personnel who is there, he should take care of the patient, whether the patient is taking the treatment or therapy in a proper way or not. So the personnel should educate the patient to take the therapy in proper way. So by this, the treatment can be very effective, and the treatment course will be based on the categories of the patient. So these tuberculosis can be categorized into initial, medium and final stages. So based on which stage is suffering with, or is based on the invading capacity of the Mycobacterium tuberculi, then the treatment should be given. So normally the treatment will be given for almost 6 months for the patient. Let us see the drugs which are used in the treatment of tuberculosis. So there are various drugs which are used in the treatment of tuberculosis, like first line drugs, second line drugs and newer drugs. So why this category is given? So as I told you, Mycobacterium will resist the single use of drugs. So first we will give first line drugs. If the bacteria will resist to that first line drugs, the second line drugs are given. And these newer compounds are recently discovered according to the bacterial structure where it is modifying. So here the first line drugs include isoniazid, rifampin, streptomycin, ethambutol and pyrazinamide. And second line drugs include PAS, PAS nothing but para-amino-salicylic acid, ethionamide, amikacin, capreomycin, levofloxacin and cyclosarin. And the newer drugs include ciprofloxacin, azithromycin, kanamycin, rifabutin, clarithromycin and ofloxacillin. So these are the drugs which are used in the treatment of tuberculosis. So here we can see the pictorial representation. See, the mechanism of action of these drugs is different. So we saw the two reasons. One is because of the thick lipid cell wall which is present in the bacteria. So there are few drugs which will destroy the thick lipid cell wall, or which causes lipolysis of the bacterial cell wall, and there are fewer bacteria which are used in the destruction of protein synthesis. So here we can see the cell wall synthesis which is occurring in the bacterial cell wall. The cell wall synthesis will be inhibited, and here we can see the ATP synthesis. So in order for the cell to divide, it requires energy. As I told you, it is an aerobic bacteria, so it requires energy and oxygen for its replication. So in that particular case, there are few drugs which inhibit the ATP synthesis in the bacterial cell wall, and there are drugs which control the transcription and translation procedure of DNA. So for the bacterial DNA to divide or replicate, it requires protein synthesis also. So to inhibit the protein synthesis as well as to inhibit the procedure of transcription to translation, that is the conversion of DNA to RNA, if RNA is formed, RNA is involved in the protein ribosomal synthesis. There are few drugs which inhibit the process of transcription to translation, where the DNA is converted to RNA, and once RNA is formed, RNA is involved in the synthesis of ribosomes. So ribosomes are one of the cell components of the bacteria. Any cell components, any cell contains ribosomes. So the main function of these ribosomes is to synthesize proteins. So if proteins are synthesized, then these proteins aid in the formation of lipoprotein cell wall of the bacteria. So in that condition, the protein synthesis have to be inhibited. If we see, for example, drugs like thioamides, nitroimidazoles, ethambutol and cycloserine. So these are the drugs which are involved through the mechanism of inhibition of cell wall synthesis. And there are drugs like diaryl quinolines as well as pyrazinamide. So these are the drugs which are used in the inhibition of ATP synthesis. And then drugs like para-aminosalicylic acid, fluoroquinolines, cyclic peptides and aminoglycosides. So these are the drugs which are inhibiting the DNA formation as well as the RNA or protein synthesis. Let us see the first line drugs. So what are the first line drugs? What is the mechanism of action of these drugs or pharmacology of these drugs? So first line drugs, what is the mechanism of action of these first line drugs? So they involve three mechanism of action. So one thing, the drugs that interfere with mycolic acid synthesis. So mycolic acid is one of the key element in the synthesis of cell wall in the bacteria. So only bacterial species contain this mycolic acid as a main component in their cell wall. So if we inhibit the synthesis of this mycolic acid, then their cell wall synthesis is inhibited. The drugs which are involved in this mechanism are isoniazid, ethambutol and pyrazinamide. And the drugs which inhibit nucleic acid synthesis, that is the drugs which inhibit the synthesis of DNA. So the DNA formation involves transcription and translation procedures. So in this synthesis, the drugs which inhibit this kind of mechanism, they also are used as an they are aiding in the spread of in the spread of tuberculosis in the body. So here the drugs which are involved in to inhibit this nucleic acid synthesis is rifampin, and the drugs which are involved in the inhibition of protein synthesis are streptomycin. So streptomycin is one of the drug which is inhibiting the protein synthesis in the bacterial cell wall. So here again we can see the clear pictorial representation. So where the ATP synthesis as well as cell wall synthesis as well as the DNA synthesis of the drug is inhibited. Let us see the second line of drugs. So in the second line of drugs, the aminoglycosides like capreomycin, kanamycin and viomycin. So these are the drugs which are used as a second line of defense in tuberculosis, and these come under the category of aminoglycosides. So because these contain glycosidic structure, these contains glycosides in their structure, and they also contain amine group. So here these second line drugs are preferred later to first line drugs because they are less effective when compared to say first line drugs. So first, if a person is suffering with tuberculosis, we give first line drugs. If the bacteria is resistant to drugs, then only second line drugs are preferred, or else these second line drugs are given in combination with the first line drugs. Here if we see the capreomycin, it is replaced with viomycin because this capreomycin has more toxic effects when compared to useful effects. So that is the reason this capreomycin is replaced with viomycin in the marketed formulation. Let us see the adverse effects of all these anti-tuberculosis drugs. So the adverse effects include nephrotoxicity. So if a person is using these drugs for longer period of time, then there will be toxicity to the kidney. and proteinuria, that is excessive formation of urea and excessive elimination of proteins out of the body, and hematuria, and nitrogen metabolism. So the nitrogen which is present in the body, that the metabolism of nitrogen will be in excessive amount, and electrolyte disturbances can occur. Let us see the other drug, cycloserine. Cycloserine is one of the important drug which is used as an which is used against the tuberculosis. So this cycloserine, it has the main characteristic feature to cause CNS disturbances. So if this drug is used for longer period of time, then it causes the disturbances in the central nervous system, and this bacteria is used only when. So this bacteria is used if these this drug is only used when the bacteria is resistant to the first line drugs. So first we give the isoniazid, ethambutol and pyrazinamide drugs, and if the bacteria is resistant to that drugs, then only this cyclosporin is preferred. Let us see the mechanism of action of the cyclosporin. So this cyclosporin is used as an anti-tubercular drug, but this is having a separate mechanism when compared to other drugs. So this drug which will block the cell wall synthesis, but in a different pathway. So the pathway which is involved in the inhibition of cell wall synthesis is different when compared to other drugs. So here cyclosporin is a D-alanine synthetase analog. So it contains a alanine amino acid in its structure. So this is a D-alanine synthetase analog, and this will block the bacterial cell wall synthesis rather than the other bacterial synthesis. I mean, it has a different mechanism when compared to other drugs. Let us see the pharmacokinetics of cyclosporin. So cyclosporin is majorly given through the oral route, and it is spread all over the body. So the diffusing capacity of the cyclosporin is more. That is the reason the cyclosporin is distributed all over the body. And about 1/3 dose is metabolized in the liver. So if we take only if we give 100% dose, then only 1/3 of the dose is metabolized, and remaining whatever the drug is there, 2/3 drug is there, it is excreted in the urine as such. So the metabolism capacity of the cyclosporin is very less, and if we use the cyclosporin for longer period of time, it causes CNS disturbance like headache, tremor, vertigo, confusion and nervousness in the person. Let us see the other drugs, thioestazone and ethionamide. So these two drugs have same pharmacology, in the sense they are having same pharmacological actions and same mechanism of action. So they aid in the inhibition of cell wall synthesis. So these two drugs are used as the first line drugs. So ethionamide as well as thioestazone, these are used as the first line drugs. So these are used against the bacteria, but the efficacy of the drug is low. In this, when compared to isoniazid or when compared to other first line drugs, these two drugs are having low efficacy, or as we can say they are having low effective. That is the reason these two drugs are always given in combination with other anti-tubercular drugs, and they are having the side effects like hepatitis, optic neuritis, mental disturbances and impotence. So if these drugs are used for longer period of time, then it may cause these side effects. The other drug is PAS. This is a newer drug which is introduced, that is para-amino-salicylic acid. This para-amino-salicylic acid, we can say it is one of the most active drug. This drug is a newer compound which is discovered, and this is the most active drug, and it inhibits the de novo folate synthesis. What is this de novo folate synthesis? So it is one of the pathway which is involved in the formation of folic acid, where folic acid, we can see the folic acid is one of the major component which is involved in the synthesis of DNA. So if the de novo folate synthesis pathway is inhibited, then the cell wall synthesis will be inhibited. So this PAS also, it inhibits bacterial cell wall synthesis, but through a different pathway, and it is normally given through oral route, and 100%, we can say almost 100% absorption of the drug takes place, and the distribution of the drug is also very good. It distributes all over the body, and the T half of the drug is almost for about 1 hour, and the patient acceptability for this drug is very low. So the patient cannot accept this para-amino-salicylic salicylic acid easily because of the metallic taste it have, or else we can say that it's not good in taste. And sometimes the patient may feel discomfort after the administration of this drug. So that is the reason patient susceptibility for the drug is very low, and it includes very common adverse effects like rashes, fever, and if it is given in higher dose, then it causes liver dysfunction. Let us see the adverse drug reactions. So what are the adverse drug reactions which are caused because of these drugs? So first thing is that any drug which is given in the tuberculosis, any drug which is given against the tuberculosis, it commonly causes rashes or skin allergy. So whatever the drug, whether it may be first line drug or second line drug or newer drug, all these drugs will cause a common symptom, or else they can show a common symptom called allergy. So skin rashes can be observed in that particular person. And let us see the individual drug reaction. So in ethambutol, if a person is exposed to ethambutol for longer period of time, then there will be severe eye damage in the person, where the person's vision is impaired. So the person's vision is blurred and he cannot see the objects clearly. And the drugs like isoniazid, pyrazinamide and rifampin, so these drugs will give, or else we can say these drugs will show adverse effects like hepatitis. So in hepatitis condition, if these drugs are given, then that condition may be worsened. So hepatitis is one of the allergic reactions, or as we can say hypersensitivity disorder. So in these conditions, we can see the symptoms like there will be severe abdominal pain in the person, and there will be liver dysfunction, loss of appetite, nausea, vomiting, as well as the person will feel fatigue. Isoniazid, if we see the isoniazid, apart from the hepatitis or hypersensitivity reactions, this also shows the adverse reactions with peripheral neuropathy. In the sense, it will show the tingling sensation of hand and feet. So the hands and feet of the person, there will be some sort of different sensation in the persons than the normal sensation. So the drug like pyrazinamide, it shows adverse reactions with gastrointestinal intolerance, arthritis and arthralgia. So in these conditions, if a person is already suffering with GIT disturbances and if we give the pyrazinamide, then the condition may be worsened. So the symptoms may include vomiting, lack of appetite, as well as joint aches. The person will feel pain in the joints, as well as in severe conditions, it may lead to gout. So gout is nothing but the deposition of the uric acid crystals between the joints in place of synovial fluid. And the other drug is streptomycin. So streptomycin, it may cause adverse drug reactions with ear damage as well as kidney damage. So if the ear is damaged, then the person can't hear properly. The hearing sensation of the person will be lost. And if there is any kidney damage, then the proper filtration procedure, or else we can say there will be, in rare cases, there will be the formation of stones in the kidney also. And in some conditions, we can see if there is any ear damage in severe conditions, the person's hearing capacity will lost, and at the same time, the person will feel some sort of ringing sensation in the ear, the ringing sensation in the ear. So this can be observed as a sign of symptoms in the adverse drug reactions with streptomycin. The other drugs like rifamycin, rifabutin, rifapentin and rifampin. So these are having adverse drug reactions with thrombocytopenia. If a person is having low platelet count, then these drugs may worsen that effect, and gastrointestinal intolerance. And the common symptoms of these adverse drug reactions include easy bruising, in the sense as the platelet count is reduced, the person, if there is a cut or a damage to that person, then definitely there will be a lot of blood loss. Let us see the dot therapy. So what is the dot therapy? Directly observed therapy. So if a person is suffering with tuberculosis, or a HIV person, if he is infected with tuberculosis, then those patients will be given the treatment in regimens. In the sense, the person will be given therapy in particular doses. So the person should take only this much dose, If the dose exceeds, then it may cause adverse drug reactions. So as the patients cannot be aware of the dose which is given by the prescription, which is given by the doctor or as the prescribed personnel, then here we have to ensure that a proper caretaking personnel, or as we can say a healthcare personnel is present beside the patient in order to observe whether the patient is swallowing the tablets or whether the patient is taking the medications in a proper way or not. So this DOT test is mainly important in the person suffering with tuberculosis. There will be multi-drug resistance. As I told you, the drugs will resist, the bacteria will resist towards the drug. So what is this multi-drug resistance, or why this multi-drug resistance is observed in tuberculosis patients? So the drugs mainly, if we give the drugs like isoniazid and rifampin. So these two are the main drugs which are given. If these drugs are given in individual, or as we can say these drugs are given individually to a person suffering from tuberculosis, then there will be definitely resistant to that drug, and there will be, the treatment is difficult with second line of drugs. So if first line drugs fail to show, or as we can say the first line drugs fail to show effect or they show tolerance, then we have to go for second line drugs. But these second line drugs can't be used alone, as these second line drugs are having lower efficacy when compared to the first line drugs. So that is the reason what we have to do is that we have to monitor, or else we have to observe the early regimen, or we have to observe the previous doses which are given for that particular drug, and we have to either increase the drug dose of the drug, or else we have to give the drugs in combination in order to show the effect. So here, what are the treatment problems we can observe while we treat the person with tuberculosis? One thing is that the dose regimen of this drug is very long, because as this is a course of almost 6 months, and sometimes it may exceed to 9 months also, it is for longer duration of time. So always a person can't be with the patient taking care for almost for such a longer period of time. So that is one of the problem when we face while treating tuberculosis. And at the same time, it shows resistance to multi drugs. So if one drug fails, if we give other drug, if the other drug fails, if we give other drug, so each and every drug shows the tolerance towards this bacteria. So this is one of the major problem, and the side effects, common side effects are observed with any drug. And the management complex, we have to manage, or else we can say we have to ensure that the therapy is taken in a proper way or not. So that is one of the problem while facing with the treatment of this tuberculosis. And the tuberculosis, the treatment must be individualized. So what does this mean? So the treatment, if two persons are suffering from tuberculosis, the treatment for both persons is not the same. So the treatment is individualized. So the treatment for first person, it will be different, as well as the treatment for second person will be different, because both the persons are having different mycobacterium stages, as well as the different conditions of the bacteria in them, as well as the body conditions of the both persons are also differing. So the treatment should be individualized, and the persons who are prescribing the medication, or the persons who are taking care while giving the treatment, they should have the thorough knowledge regarding the multi-drug resistance. So if they don't have enough knowledge and they are giving the drugs as such, then there will be no improvement in the patient. We have to make sure that always the personnel is under DOT test. We can see, in the sense, we have to make sure that the person is observed on regular basis, and the treatment will be last for 6 months to 9 months, and in very severe conditions the treatment may even exceed to 18 months also. So here we can see these are the few bacteria, these are the few drugs which are showing resistance towards the bacteria. So here the bacteria, example, the drugs like isoniazid as well as rifampin. So mainly these are the two drugs which are showing resistance towards the bacteria, and remaining drugs are effective, but they are not mostly preferred. So the clinically used drugs are isoniazid and rifampin. So mainly the combination of these two drugs are given. So there are other drugs like thiamide, cycloserine, cyclic peptides, ethambutol, fluoroquinolines, pyrazinamide, and para-aminosalicylic acid and aminoglycosides. These are also clinically used but not used alone. They are only given along with combinations.